In veterinary medicine, having a catheter placed in our critical patients is very crucial for their overall care. As you may know, having a catheter placed is great, but it can also come with certain risks also as well, certain as dislodgement of the catheter actually breaking or the line breaking, which can cause medications to get lost, not sent to the patient, blood loss that could be occurring, especially in those patients that actually need their blood, and the list goes on, which overall hinders the patient's care. Covetrus has designed a revolutionary tool to help address these challenges and make things better for the veterinary community. Say hello to the breakFREE Breakaway IV Connector. The breakFREE Breakaway IV Connector is a cutting-edge medical device that basically separates when harmful force is exerted across an IV line. Some great benefits about the breakFREE Breakaway IV Connector are it has an ISO lure connector, so this works great with a lot of things that we have in veterinary medicine. At this point, they will be able to utilize this portion for. Another great benefit is once this separates, you have no waste that you're really having to deal with. And that's more time that your techs or your assistants are being able to utilize towards other patients because they're not having to do a whole lot of cleanup. Once that breaks too as well, the medication that's typically going through or the fluids that are going through, it basically sends an alert to the alarm to the pump to tell it, hey, there's an occlusion, to stop things, and that alerts a tech or an assistant to go evaluate the patient at that time for them. So the good thing is you're not losing any medications. Also on the opposite side of the patient that's connected to this, you're not losing any blood. So especially those patients who really need all the blood that they have at this point, they're not losing any blood from dislodgement to the catheter. And then once this breaks also, you don't have to even go replace the catheter. You're able to reattach a new one at that point with the catheter still in place.